When fat meets calcium in the abdomen, it's not a cooking show. It's called saponification. It's a telltale sign of acute pancreatitis. Pancreatic enzymes, like lipase, spill out. They digest the fat cells and they release fatty acids that bind the calcium. What's the result? Chalky white lesions in the mesentery. On histology, you see ghost-like fat cells and blue calcium specks. So, a 40-year-old man dies a week after severe abdominal pain. Autopsy shows chalky white in the mesentery and also some fat necrosis and calcium deposits. What's the cause? It's going to be acute pancreatitis. This is a release of your pancreatic lipase that causes fat necrosis. So, these freed fatty acids will bind your calcium, forming the chalky white deposits. Peritonitis, you'd see the pus and the neutrophils. You wouldn't see fat necrosis for that. Celiac, you'd have no serosal mesenteric changes. Crohn's, for celiac, maybe you could talk about like T lymphadenopathies and like T cell problems later on, iron deficiencies. Crohn's, look for creeping fat. Transmural inflammation would be your Crohn's disease. The transmural creeping fat. And perforation would show full thickness defects. You wouldn't see that chalky deposit stuff. Ischemia, dark red bowels. Coagulative necrosis, not fat saponification. So 3 things that we need to know to answer all these questions right in the future. 1, release of lipase and the digestive enzymes in acute pancreatitis. We have to know that in acute pancreatitis, there's intra-pancreatic activation of digestive enzymes. So particularly lipase. And lipase, what will happen with lipase is you'll have increased acinar cell damage and inflammation of the pancreas. And this process initiates fat necrosis due to the destruction of adipose tissue. 2, you have to know saponification and chalky white stuff, right? The liberated fatty acids and damaged adipocytes bind the calcium ions, and that results in the formation of insoluble calcium salts in a process known as saponification. And this precipitate is going to appear as a chalky white lesion on gross examination, and it's visually distinctive from other things during autopsy. And 3, histological findings of fat necrosis. So you have to see the necrotic adipocytes. These are going to be anucleates with necrotic debris alongside the blue calcium deposits. These findings are characteristic of extensive fat necrosis that spread to the mesentery and along abdominal structures in acute pancreatitis. That confirms the diagnosis. So 3 things. 1, release of lipase, acute pancreatitis. 2, saponification and chalky white stuff, right? You have to know that the damaged adipocytes will bind to calcium ions. You got to know that. They'll form insoluble salts. And then 3, you have to know the histology, just like what does it look like to have a dead fat cell, enucleate, necrotic debris, and then the blue calcium deposits are going to be, having a fatty old time with those fatty acids and the damaged adipocytes. Those are the 3 steps to never miss another acute pancreatic question. If this is helpful, like and subscribe. If you want to see me change my approach, let me know. If you like my shirt, leave a comment below. And if you want me to change the lighting in the background, let me know what color.